Yes, okay. Hey, everybody. I know there is so much to talk about. We're going to have time over lunch to talk, but I know you are not going to want to miss a word. I am so thrilled to have Ken Brown here from the Louisiana Peer Initiative, and he is here with two of his spectacular young people, his young peers. And I got to tell you that Ken is marvelous, and he can even break my very professional stance when I am concentrating and doing what he calls my golf announcer voice and make me laugh. I know he's going to touch your heart, as will the young people, and he'll also make you laugh. So I'll let Ken introduce his young folks, and please help me in welcoming them.
Okay. Wow. Thank you for that. So my name is Ken Brown. I'm a teacher at Iowa High School, which is about 3 hours from here, Southwest Louisiana. I'm here with two of our students that are in the Peer Initiative program. I'm going to let them introduce themselves real quick.
Thank you so much. My name is Ashlyn Roberts. I go to the same school that he goes to. So yeah, it's pretty good, pretty far away.
We're both seniors.
We are, yeah, actually. we have so much in common if you couldn't tell. We're like separated at birth. But anyway, I'm part of the Peer Initiative program. I did the assist training, and that's kind of what I'm going to be touching on today. And yeah, I'll pass it on to Jazz.
My name is Jasmine Wooten. I am a senior at Sam Houston High School, which is about the same amount of time away as it is for them. I'm also a part of the Peer Initiative, and it has hit me very deeply, so I'm going to be talking about that today as well.
So how did we get started? Peer Initiative started as a high school club, actually. It'll be 10 years ago next year. So 2014, I was teaching at Sam Houston, where Jazz attends. My son was a freshman there. And we lost 4 students between February and November. The first student we lost in February was a classmate of my son's. So it hit me from a parent standpoint and from a teacher standpoint. And so let's just talk about the night that happened, that first suicide. When my son found out, it was obviously traumatic. So later I say, do you want to go to school the next day? He's like, yeah, Dad, I want to go be with my friends. He's gifted, so the gifties, I don't know how it is all over the place, but in Louisiana, the gifties are segregated, so they form a close bond with each other. Went to school the next day. When he got home, I asked him how it was, and so they sent a crisis team with all the counselors from all over the parish to come talk to those kids. And this is his words. So he's like, Dad, the counselors are worthless. I'm like, okay. He said, but what helped was Crosby came in and talked to us. Crosby was a senior. 3 years before that, he had lost one of his best friends to suicide. So Ryan said that helped. So after November, when we'd experienced the 4th tragedy, we knew we had to do something. So we took that model of what worked there, of what Crosby did, and started looking around the country to see if there were any peer support programs out there. We didn't see exactly what we needed, so we put one together. Our program is partnered with McNeese University, specifically with the psychology department. That psychology department comes in and trains our students in peer support. One of the complaints we got with the district, it took us a year to put this together before the district would allow us. One of the complaints we got was that, we kept getting, how can students be a replacement for professional counseling? They aren't a substitute for professional counseling, they're a bridge to professional counseling. And so that's where we went. So the way it works is students meet with students. If students have a session and they meet with a kid that's something too big for them to handle, they pass it back to that clinic at McNeese University. They provide licensed professional counseling at no cost on the campus to the students in need. So the students are the boots on the ground, identifying those in crisis, and then we have professional health care that follows up. So that's the model that we've started with, and it's since that one school in 2015, We're now in 2 parishes across the state, Caddo, which is North Louisiana, Shreveport. We're here in Baton Rouge. We're in Dutchtown, which is just the largest high school in the state. We just got in Lafayette, which is about an hour from here. So, and we just got a grant last week to spread into this area here for Southeast Louisiana, for Baton Rouge and New Orleans. So we've experienced rapid growth. I will give a shout out to my MHA peoples, Stephanie and Andy, and Melissa, wherever Melissa is, because the rapid growth we experienced was a direct result of our partnership with MHA. They sponsored us for a Blue Cross Blue Shield Foundation award. We got that award in 2021, and then within the last 3 years, Blue Cross has invested $350,000 in our high school club, which so we got Miracle Grow poofed into a nonprofit. So what do we do? First of all, I don't know if you're familiar with the stats in our state, but suicide is the second leading cause of death for teens. At any given time, 1 in 5 teens are experiencing some type of mental illness, and at any given time, 1 in 20 teens are experiencing suicidal ideation. So what that means at Sam Houston, the school Jazz is at, is about 1,200 students. My brain hurts. I'm a social studies teacher, but I'm going to try to do math. So 1 in 20 there is, what is that, Ash? 60? Wait. Don't look at me. Let's do math. What's 10% of 1,200?
So it's 240. No, 1 in 20. It's 60. My bad.
I'm going to do the math. So 60 kids, 2 full classrooms, right? So at any given time in that one school, there's 2 full classrooms. Sorry to put you on the spot there. So there's 2 full classrooms of students having suicidal ideation. So our task is to identify those kids and to get them the help they need. So that's what we're all about. Peer Initiative, we have 3 main focuses. So first focus is peer support. That's what we just talked about. Second focus is education. We have also, in the last couple of years, we've gotten contracts with the state of Louisiana to deliver trainings across the state to students and teachers and counselors. We do assist and safe talk trainings. And the third prong of what we do is advocacy. We meet with legislators. We sponsor legislation to increase teen safety through systemic change at the state level. And while we're there, at this time, we do have a proposed bill, so if there were any legislators in here who would love to support us, we are shopping this year a bill that would, in Louisiana, anytime a student expresses suicidal ideation, there's a risk assessment done. That risk assessment identifies them at either low, medium, or high risk. Those risk assessments are being done, but there's no data collected as to how many are being done or the demographic data, age, gender, race, anything like that. So we're data-driven on everything else in education, but we're not data-driven on suicide prevention, which doesn't make sense. So we are proposing a bill that would require districts to gather aggregate, non-identifiable student data and report that to the state every year so that we can develop actionable, targeted, strategic plans that work and are effective, because now we have the information and we're not flying blind. So we'd love to partner with anybody in here on this. And then now we're going to step back one sec. So as far as peer support goes here, I'm going to let Jazz speak a minute and just talk about what peer support looks like. She's on the peer support team. She provides sessions to other students in need. And I'm just going to let her describe how that looks at the school where she is, Sam Houston.
All right, so peer support at Sam Houston, it's a small group of teen leaders, and what we do is if we hear a recommendation of a student needing help or needing someone to talk to, we will schedule a time between both of our schedules to meet up, and it's all confidential. We sign paperwork with the student. It's kind of like going to a regular counselor, like it's secretive. We can't tell anyone anything. unless they tell us they're thinking about harming themselves or others, then we're that bridge to the higher level counselors. But we've saved a lot of lives at our school doing this, and I think it's a very big thing that a lot of people need, a lot of students need. It's a lot easier for a peer to talk to another peer because it's like having a friend there, rather than feeling like, okay, well, this adult isn't going to understand me. How do I go to them for this issue? Like they can talk to us about anything. It doesn't matter what it is, as long as they just need someone to talk to, they just need a friend to talk to, we're there for them.
Perfect. And so before they can do their first peer support session, they have to go through training. And the training that these young people undergo is the same training that the adults go through for counselors and actually the suicide helpline operators. So one of those trainings is assist training. I'm going to let Ash here has been through assist training, so I'm going to let him describe to you some of the training they go through.
Thank you. Thank you so much. So the assist training, I took it last year, and it's 2 8-hour days completely, just straight shot. And the situations that they put you in are the best way I can describe them is very, very real. Because I feel like a big thing with this is recognizing how big of an issue it is. And one thing that they really specialize in that training is making sure that they're showing you something that's as close to the real thing as it can be. Because one of the biggest things is I don't think many students or even just people in general really realize how scary it can be, dealing with or being face to face with someone who is thinking about suicide. And one of the biggest things that they prepare us for is being able to become face to face with somebody that is experiencing those thoughts and that is truly thinking about just taking themselves off of this planet. And the training that they give us, it's thorough, it's real life situations that we're going to do. They have so many different scenarios that they put us through, and a lot of them are real. We have so many different sessions where it's almost like acting in a way. We'll have one student that's the person at risk, and another student that's the peer support, and we're put through so many different scenarios that we're going to see in the school and that we're going to encounter, so that whenever we see them in our actual high schools, we're able to tackle them and we're able to properly assess what the student needs and what they need to hear, and properly bridge them to someone who is able to give them the proper help that they may need. So.
And both of y'all can answer this one, but just speak on, so assist, it is the same training that counselors and emergency providers go through. When I got trained to deliver that training, the national expert that trained me, I told her I wanted to start delivering this to high schoolers because the group that developed the assist training, Living Works, says it's appropriate for anyone 16 and older. But when I told her we were going to start training teens, that national expert was a little uncomfortable because she didn't know anyone else in the country that was training teens in assist. So she actually came down and trained the first group with me in January of 23, and she was blown away by how the teens took it and everything. And so since then, we have a contract with the state to deliver these trainings to teens. We're gathering data, and if the data shows what it's supposed to, then they're going to make delivering assist to teens a best practice and encourage it throughout the state. So we're really, really proud of that. I'm just going to let both of them speak on what it was like taking this training, knowing that it's the same training. They're 16, 17, and that it's the same training that those mental health professionals go through.
Do you want to go?
I can go first. So when I took the training, I was freshly 16 years old, and it was not what I really expected to go to at first. It's very intense, but it's very empowering. As someone, whenever I was 16 years old at that age, I looked at it and I was like, I know what it's like because I felt that way, and I see other people who feel that way, and it's real. Like, it's not, there's such a stigma to it that you take this training and you're like, this is real, and it helps you to prepare for like what Ash said, when you encounter people in real life situations, you have that that card and that memory to, okay, well, this is how I was trained and I know how to do this. I can help this person. Whether it's in high school or whether it's in a future job or a future career, you are prepared and you have that ability to help someone else and be that bridge to be someone's light.
And Jazz, while you're on that, I think you touched on it, but why don't you speak a little about how you got involved in suicide prevention? How did you come to be a part of this?
So back in my sophomore year, I lost a family member to suicide. It was unexpected. I hadn't seen this family member in a while, but they lived with us for a couple of years before they moved back to California, so it was still someone that I held close dearly to my heart and that I missed. And when I found that out, I knew, okay, I have this program at school. Maybe this is my calling. So Miss Jolie and Mr. Brown, I did everything I could. I got the trainings done. I became a peer support team member, and it just feels like something that I'm passionate about. I want to help people. I want to be that light to people. I want people to come to me for comfort and for help, and I want to be able to bring people joy and happiness in their life because everyone really deserves to be joyful and happy. So that's my story.
Amazing. And Jazz, just speak on, have you put your training to use, and have you, saved a life through this? Without specifics, just describe that experience.
I have put it to use twice. It actually wasn't inside of school, it was outside of school. And how I put it to use was, one of them was suicidal, and so I got them that bridge and I got them that help. And then the other one just needed a friend to talk to. And ever since then, they've come up to me, they see me in the hallways, or they text me and they're like, thank you, like, you've helped a lot. And it's something that, it doesn't have to be someone you know. It can be anyone random, but it truly helps people when you're able to put that to use because they're able to see that you can understand them without there's no wall there. There's just open communication.
Thank you. And Ash, I know we've talked about how heavy all this is, but I know in the training one thing we stress is that it's not on you to save people. Your job is to get them help. We're not putting the weight on your shoulders. Does that give you some, a little less pressure when you know that it's not all on you, that your job is to connect them with life-saving help?
Oh, of course. Because the reality of the situation is knowing all that pressure being on you, that you may have this idea that, oh, it's on me to save this person, is completely crushing, especially to people our age who are still developing. But just knowing that we are there to serve as that bridge allows us to truly put all of our energy into just being that bridge, knowing that we don't have to overextend, we're not here to solve all their issues, because the reality is that we truly can't. All we're here is to keep them here as long as we can. And I feel like the assist training truly helps us to do that. I want to touch on one thing you said earlier, that we are the boots on the ground. Because in reality, it can be really hard to build up the courage to talk to these random adults who you may have absolutely no connection to. And us students, we are on the battlefield. We are in ground zero. And having this experience to be able to help our fellow peers, I think, is so empowering. Like what Jazz touched on earlier, I feel like one of the biggest tragedies is being able to recognize these people who are going through these thoughts and these experiences, but being powerless to help them. And I feel, because of how common it is, it's insane that almost everyone that I could talk to knows at least one person that might be at risk. And the fact that they might not be able to be that bridge for them, I feel like is a tragedy. And I feel that if this can be more expanded on, this resource can be provided more widely, I feel like we might be able to one day have an environment in which there is you're never going to be in a dead end. There's always a bridge through anyone that you know. And there's always a way to reach a person that can actually help you, and that's going to know what you're going through.
Perfect, thank you. And we want to leave time for questions, but I was just going to say this, so I know the theme of this conference today is ripples, right? And so there is actually a suicide documentary called The Ripple Effect, right? That says every time there's a suicide, it's like a pebble dropped in a pond, right? and that those ripples spread out. But we just like to say those ripples don't have to be negative, right? They can be positive. So that's what we're focusing on, is just trying to be a wave of hope and strength for those of them that need it out there. So thank you.
For what you do. It's really impressive. Have you seen, after this program has been implemented, any type of effect on the culture and bullying that might have taken place in the school?
So I do believe that bullying and mistreatment by other students can have a big impact on those feelings within peers, because in high school, there's a lot of cliques and there's a lot of groups, and with peer support and pilot, we're expanded to anyone and everyone who needs it. So I feel like it gives a safe place for those people who are being bullied or who are struggling with people just bringing them down and taking them down every day. We have that open space. We have games and we have little events that we go to. We're a safe environment for other kids.
And if I'm allowed to touch on that too, I really do feel like, oh, that's my bad. Yeah. But I truly do feel like having kids go through this program, it's not only teaches them to be a support for their fellow peers, it pushes them to be it. Because I feel like there's so many students that want to help, but they don't feel like they have the resources to do so. And bullying is going to happen in every single school. You know, it's a sad reality that all of us face, but I feel as though having these kids on campus who are trained and who are empowered to help these people that are going through these crises, I feel like while the bullying may still occur, the actual impact of the bullying itself is severely minimized. Because, say, if I was being bullied and my suicidal thoughts were being strengthened by all this harassment that I'm going through, the fact that I know that I have so many people around me that are willing to listen, that are able to help me, and that I know that I can truly trust with all these things that I'm feeling, the impact of the bullying is severely dulled.
Ken, I wondered if you developed in conjunction with MHA a training that can be used in the classroom based on your experience here that's available for free to any of the affiliates that want it.
Well, I just remembered that the Louisiana MHA and Peer Initiative did partner together to develop a approximately 1-hour training that can be used to identify, the risks of teen suicide, the statistics about teen suicide, and some protective factors. So we would love for people to take advantage of that and use it. Thank you, Stephanie. I appreciate you. The subtle way you did that was very...
Directed toward the students, what do you do for yourselves for self-care?
So self-care, I sometimes take a break from social media. That's all you can do sometimes. I do things I enjoy. So things I enjoy would be, I do my sport, I throw javelin, I hang out with my cat, he's like my best friend. I take time for myself away from all the distractions that could be causing me to feel kind of stressed and anxious, and I just take me time. So,
Yeah.
What do you do for self-care, Ash?
For me, honestly, the same thing. I have 2 lovely cats. They suffocate me in the morning, so it's very nice to know that I'm loved every single morning whenever I wake up. But whenever I'm going through these emotions that most teenagers go through, anxiety, stress, a lot's put on us, to try and be successful. But whenever I'm feeling overwhelmed, I think a big thing that the training and just being in this environment has really taught me is vulnerability. Because prior to the training and prior to being exposed to all of this, all of these great coping mechanisms, I was a very reserved person. I didn't. Oh, absolutely. Anyway, I was a very reserved person. I didn't feel as though I could speak about these things that I was going through. I didn't feel as though that it was something that was even worth talking about. But after being exposed to all of these all these programs and all this education, I now know the validity of what I was feeling, and which allows me to properly address my feelings and be vulnerable, talk to my friends about it, talk to other peer initiative people about it, let them know what I'm going through, and know that it's truly okay to feel what I'm going through. There's no weakness in it. There is nothing that tears down my character, what I've been able to achieve. And I feel like that's a big thing. I don't do anything really in specific, but I feel like one thing that I really want to stress is the vulnerability that has been taught to me through this program.
And I'd just like to add real quick, one thing, that's one of our biggest concerns, is our biggest priority is safeguarding our teens. So before they can enter into a peer support session, they have to complete the intake paperwork for that clinic that we're associated with so that they can be debriefed and have help there if they need it. So we have those supports in place, and it's actually a requirement. They're not allowed to take place in the peer support team if they don't agree to, have that paperwork on file where the parents agree and they agree that those sessions can be there. So we're very protective of these guys.
So you may have already mentioned this, but once you have those students trained, right here, sorry. Once you have those students trained, how are other students connected to them? How do they know who to go to when they're in a crisis situation?
Do you want to talk about how you're identified and just maybe touch on the club real quick?
Yeah. So, wait, I'm sorry.
How do the students know who you are? So the billboard, the shirt, all those things like
yes.
that. So.
Throughout our school, we have a bunch of posters around so kids can see. We also have, like, Miss Jolie in the library.
Why don't you introduce Miss Jolie and tell everybody who she is? So there.
Miss Sarah Jolie is our sponsor, our club sponsor, and she is, like, amazing. She's always on top of things. So, yeah, we have posters around the school, and we also have teachers. If a teacher notices something wrong with a student, they can recommend it to Miss Jolie, and Miss Jolie will recommend names. If a student can pick who they want, and if there's someone they don't want as their peer support, they can pick someone else. It's completely up to them. But we're announcements, posters, Miss Jolie recommending teachers, counselors.
So they have T-shirts that they can wear. The school allows them to wear. We're uniform state in Louisiana, but they're allowed to wear them that identify them as peer support members. Yes. And I'll just go a little bit deeper with Ms. Jolie. She is the co-founder. She doesn't like to come sit at the table, so we have to do this. But peer initiative would not exist without her. And if anyone is interested in mimicking what we do, she would be a great resource because she is the person that handles the logistics. She's a librarian at Jazz's school, and she basically runs a counseling clinic out of the library. So. I see another one in the back after that.
I wanted to know how you or do you provide any statistics to funders about the efficacy of what you do? Like, how do you prove, and this is something that I think fellow MHAs wrestle with, how do you prove that because you provided this intervention, something did not happen?
Okay, so the data that we provide is qualitative through that respect. The number of students reached, the number of sessions we provide, and then we have quantitative and qualitative. So we have the data that supports those things, and then we have qualitative data, like Jazz was just saying, that's interviews with students, if they wish, that speak upon this, and so our funders love that, right? So the last time, Jazz got interviewed, Blue Cross, who gave us the $350,000, right? They interviewed her with their media team. And so we asked how it went when she came out. And they're like, the cameraman was crying, the interviewer was crying, Jazz was crying, everybody was crying. So Blue Cross was like, perfect, right? So so that's, and then district-wide, that's what we're hoping this data collection will do, that we're proposing our bill, that we can show the reduction in risk assessments that's happening, right? So that's one reason why we're pushing that. So I see they're telling me to shut up here, but I think we had one more question. Are we allowed one more question? I'll allow it.
Okay, I have a quick question.
Hey, look, if it's Tanja, you can ask.
Okay, you guys do amazing work. I'm familiar with your work. But we also know that suicide among African American teens are on a historic rise.
Right.
And I'm glad you guys are coming to the East Baton Rouge area. We'd love to help out with that. But any, would you like to comment on that as you move forward, addressing that need in, the community?
Yes, so the fastest rate of increase in suicide is African American youth, so black youth. So we are taking a targeted approach to that. We're in Caddo Parish, which has a large African American student population. And so what we've done there is we have partnered with Grambling with their social work school up there to have their social work interns come and deliver some trainings to the youth there. We've also trained Miss Carla Burgess up there, who's with the Community Foundation of North Louisiana. She has a teen advisory council up there. So she's delivering some of those same trainings to the schools. We just trained with MHA. We partnered again and trained Miss Tasha Trustclair, right? She's an LPC or social worker, who's an LPC to deliver assist to the Southeast Louisiana region. And again, I spoke to you earlier, but we just received a grant partnered with the state of Louisiana to specifically target black youth and make strides in the Southeast Louisiana area. So we are attempting to address that very issue.
And thanking Ken and Ash and Jazz.
Really appreciate you.
Thank you. Thank you. Thank you. They'll be hanging around a little bit too, won't you?
And if you want, there you can.
What? You guys okay?
You got it, Ash?
All right.
Oh, awesome.
All right. You've been hearing about this cool program in Louisiana, and Louisiana has some other fabulous things going on. I'm so happy that Assistant Secretary Karen Stubbs Church is here today. Karen, where are you? Oh, there you are. Come on up. She's going to tell us about some more of the fabulous things that are happening in Louisiana. And then you're going to hear about even some more. So, Karen, come on up. Thank you for joining us.
Good morning. I think we might have on the agenda changed Kobe and I around, so we'll go with it. So, which is unfortunate because he's going to probably touch on a little bit that I've done. Let me start by introducing myself. I'm Karen Stubbs. I'm Assistant Secretary of the Office of Behavioral Health in the Louisiana Department of Health. I'm the State Mental Health Commissioner. We're also the SSA for substance use as designated by SAMHSA. We are the receiver of all of our federal block grants and federal grants around behavioral health within the state. And we have policy control over our behavioral health services in Medicaid. In Louisiana, the Medicaid Department and the Office of Behavioral Health are co-located under the Department of Health. So we have a very close relationship. When I started talking to Melissa and then Mental Health America national people, and we were talking about what we might come and present today, it felt, let me see, where do I point this? Does anyone know how I changed the slides? There we go. It felt to me just a little bit like speed dating. So while it's completely unrelated to my topic, the picture in the middle is what you Google what you find when you type in speed dating, right? I was talking to them about things we were doing, and I was like, I don't know what we're doing that's different. Like, everybody's doing something around peers. Everybody's doing something around crisis. Everybody's submitting 1115 Medicaid waivers. And as we started talking, there are little elements of all of these things that most states are doing that are unique to Louisiana. And so we then kind of got on a roll, and we were rattling off different things that I feel like not everyone's doing within those spaces that everyone should be embracing that are different. And so it was basically like, well, just throw it out there. And I thought, so, I'm going to be like, I like, sunsets and long walks on the beach. You're like, I like that too. Can we talk later? I like this. So, so that's a little bit the format of this. It's like a really quick and dirty, like, here's some things we're doing. We can follow up later if they interest you, and maybe we're a match, and we can share some information. I do want to say, Tanja and I talk on a lot of the same circuits, and in this safe space, need to be honest, I hate going after her. Especially on a national level, because we're both from Louisiana, and I don't sing. And she started by talking about, she has this dynamicness about her, and it really draws you in. And every time I hear her speak, I hear about a different story in her life. It is moving, it is motivating, you cry, you laugh. It is an experience, an emotional experience. That's not what you're gonna have with me, but because my style is very different. But it's like a 1-2 punch. You get so motivated by her, and then I kind of come in and say, and so then you can do these things, and here's how you do it. So it's gonna go a little fast. I have some slides with some visuals, in case you're able to take the slides home and you'll know, can kind of follow along. This is just a little bit of an agenda on some things we're gonna touch on in my speed dating 30 minutes. So a couple of things, the ASAM 4th edition review. So those of you in the substance use disorder space, if you don't know, ASAM, the American Society of Addiction Medicine, came out with an updated 4th edition. Louisiana has really embraced the ASAM standards as required in all of our Medicaid substance use services. We just underwent, what makes us special is that we just underwent a very public and provider-involved review of what it would take to transition from the 3rd edition to the 4th edition. It served multiple purposes. It educated all of our substance use providers about what's in the 4th edition. We got to hear directly from them what kind of changes it would take, the cost around that, looking at the rates and things like that. So it was a really nice exercise that we did. We had work groups for inpatient, for outpatient. We had facilitated conversations. We had written surveys. We had webinars. We had small work groups and large work groups, and it was really great. It was a great experience. So if you're in the substance use world, you need to be aware that that evidence-based practice that you're following has now been updated. And there are some pretty big changes. We have so much going on with higher education institutions. It's really its own presentation or multiple presentations, but we've really embraced, largely through our block grants and our state opioid response funds, but also through some other funding sources, creating some really unique things happening in schools. Outside of 988 that you're gonna hear a lot about today. Collegiate recovery programs, giving college students on campuses some safe space if they're in recovery, some groups, some physical places to go. We've partnered very closely with our Board of Regents, who oversees all of our higher education, 2-year and 4-year colleges, to do a lot. Basically, we have figured out that if we can give the money to someone who's not within the Department of Health, it gets spent a lot faster, a lot smarter. People are a lot more willing to kind of have that conversation and implement on their behalf versus our behalf. So we've got some really great relationships to the Board of Regents where they're doing trainings, they're placing naloxone in dorms, they're doing a lot of mental health trainings, and they've also developed a Center for Prevention Resources. So this is all about prevention. It's a whole kind of center for excellence, reaching out to those grad students, trying to promote people to both enter the profession, but also train the profession, the academic profession on mental health and substance use awareness. So some really unique things happening in our higher education. We're going to talk a little bit about 988, but I'm now not going to focus too much on this because Kobe after me and Laura Evans are going to talk, I hope, a lot about what we've done in this space. It will be the third time it's been mentioned today. We're very proud of our campaigns that have been nationally recognized. There's a couple of other things I'm going to talk about with 988 that we were the first to do and we're very proud of. I put this slide just in case someone doesn't know what 988 is, just in case, as kind of an introductory slide. So we're going to talk about our online dashboard in just a second. This was the slide I was going to talk about, our nationally recognized campaign with HCBUs. This is just one screen of all of some of the media that we've created. We've got commercials. We do this as an hour-long presentation and we show all the links. They're really moving. It's the one thing I can do where people might end up in tears and it's actually not even me talking. But I do want to point out my favorite, because this is kind of what started it all, is the Queens from Grambling and Southern University, two our largest HCBUs here that have a real history in Louisiana, and they have this huge football game called the Bayou Classic. This initiative started with us sitting in Quinetta Womack, who works for me and is amazing and does all of this work. And we were like, let's get one of the queens. And I was like, let's get them both. Let's have the first time these two rival colleges join together for a common cause and literally appear. And these ladies jumped on board, the schools and their advisors behind them jumped on board, and it really just started this momentum of this entire campaign. These are real students that go to the college, and you'll hear a little bit more about that later. We speak nationally on this all the time. It was really amazing. Mobile response, also not something that's new to this group. When we were talking about our crisis mobile response, I said, but what are we doing different? We started a little later than a lot of states. You know, you've got your Texas, your Georgia, they've been doing it for 20 years. What am I gonna say? But we have carved out a few things that I do feel, maybe they're not completely unique, but they're not widely done in every state. For example, in our adolescent youth crisis mobile, we've developed a peer support role, a family peer support. So we all employ peers in our crisis system, our crisis continuum, I hope, but we developed a specific family peer support. So when they deploy for the adolescent or youth, as already been mentioned today, it's really responding to the family. It's usually the caregiver that's calling, or a lot of time it is. And so this family peer will be part of that mobile outreach unit. And we're really excited about that. Another thing we're doing that we've already seen and heard some amazing stories about is put in an automatic trigger. That if a child has been involved with DCFS and has had any movement, maybe it's going back home, maybe it's going to grandparents' house, maybe it's going to foster care, any movement is identified as a crisis and gets a crisis mobile response. So that means our adolescent crisis mobile team is responding not during an active crisis, but is going out hopefully on the same day or two as that movement happens, creating that relationship, meeting the family, meeting the new placement, meeting the child. When you get a crisis mobile response in Louisiana, it's authorized for 72 hours. So there's a 3-day window that provider is getting paid anyways to continuously follow up for 3 days to maintain that stability. In this case, it's developed that relationship. What we heard over and over again from our Department of Child, basically our child welfare entity, our DCFS, was grandmother doesn't want to take this child because of the behaviors. So-and-so relative or foster home can't take the child because they need some additional supports. It's more than they can handle. And they have a hard time finding families and convincing families and getting foster families. So we said, this is how we can help. Let's give them support immediately with a an entity that comes out to them. And then we said, even better, let's have them meet before there's actually a crisis. So we're pretty proud of that. We've seen this work even outside of our DCFS system. We had a story of one grandmother who saw this on social media, called the crisis mobile team because she took in her grandson that had some really big behaviors. It helped avoid her interaction with DCFS. She said she probably would not have been able to take him if they had not responded and created that support that she felt. And so the child didn't have to get involved in the system. So that was an unexpected positive story for us, and we were really proud of it. We also, I don't think I did a slide for this one. It was a bit of a tough and controversial decision, but we decided to allow our crisis mobile teams to respond to emergency departments, so in an ER. A lot of people said, but they already have staff, and what we kind of talked about, and it was a big debate, was that our EDs are the gateway to our inpatient psych hospitals. I think a lot of states are like that, maybe not all, but if you end up in an emergency department in a mental health crisis, it almost always ends up in an inpatient stay, not necessarily always needed. So we've started to see we've heard a couple of really great stories where the ED called the crisis mobile team. That crisis mobile team sat with them, worked with them, connected them immediately, of course had that 3-day relationship, and the person did not go to an inpatient psych hospital, was able to be released home with supports. That is one win for us. This is still a pretty new system, so I'm sure there will be more, but to hear that pretty early on was a really good indicator. Workforce development is something, if you haven't heard, there's a behavioral health workforce shortage. And so everyone's talking about workforce development, also something I said, we're having the same issues as everyone. But a couple of things that we've done and seen some movement on, I'm just going to talk about peer expansion in emergency departments and hospitals is something we're working really closely on, following the California Bridge model, which is rooted in substance use, but we're talking about kind of expanding that bigger into mental health as well, and kind of creating some measures to work with our hospitals, both for ED and hospital, to place peer kind of navigators in those for discharge. We dipped our toes into provisionally licensed mental health professionals in Medicaid a couple of years ago in a very specific service, had a good response, and now all of our provisionally licensed professionals can bill in Medicaid, and we've gotten a lot of really good feedback on that, not just expansion of the provider pool, but provider clinics and facilities who rely on obtaining provisionally licensed professionals. Those provisionally licensed people fall in love with the agency or the work or the facility and then stay, and it increases their licensed professionals versus just needing to get that internship or that those hours done. So being able to bill for their hours in a respectful way is really exciting. Things like telehealth training. So when we went to the pandemic and people were moving to telehealth, we thought, you just don't do the same exact thing, but on a video, especially in our evidence-based practices. So we employed professionals, especially around our EBPs, to come in and give trainings to providers on how to implement those same practices through telehealth, but with fidelity, and be able to maintain that credential as an EBP. We've done all this through our Center for Evidence to Practice. This is a relationship with LSU Health Science Center. We've been able to leverage Medicaid federal match, block grant dollars, other grant dollars to send to LSU. They're training providers in Louisiana in an array of evidence-based practices for free to that provider. So this is workforce because maybe they are an LMHP, but they can't afford to go and get trained in these really expensive, really intense, a DBT, which is 18 months of kind of oversight. So we do it all for them for free. All they have to do is fill out an application and then attend the training trainings and they get continuing education ongoing for free. They get consultation. And we've grown this is just for evidence-based providers. Most of these are home and community-based, so the dot doesn't mean a physical location. It kind of responds. But you can just see in a few years how that has allowed us to grow our EBPs. Disaster response, and I know this is also on your agenda later. Louisiana employs full-time disaster or emergency response staff. Part of that is because unfortunately we're almost always in emergency response here with our hurricanes, but this is something we call like blue skies. So even when, and that of course stems from hurricanes, although our disaster and emergency response is much larger now than just for hurricanes and water-related events, floodings and things like that. It's much bigger. But this allows us to do a lot of things that are unique to Louisiana. One of them is to be able to very quickly pivot and get these FEMA grants called CCP grants, crisis counseling grants. A lot of states have moved away from even applying because they are so difficult and complicated. We keep full-time staff that full-time are trained. We can turn these around in a couple of days now. It's really amazing, and when the hurricane happened and hit Kentucky and the East Coast, we actually reached out and said, can we write these for you? Do you need some help? We've got full-time staff and we're not in emergency response now. With no-cost extensions, we basically can keep under one hurricane and one FEMA grant community-based crisis counseling programs for over a year in the state. After the pandemic, we utilized these and we had community-based crisis counselors for years. So we do that really well. This is something that's really important because not a lot of people know about it. Louisiana was the first state in the country to submit our initial application for broadband dollars, federal broadband dollars. Usually, if you were like me, I'd hear internet or broadband and think, oh, not it. I'm behavioral health. I can stop listening to this. And so that is not true anymore. And I love the earlier slide where they talked about all the federal appointments and they had some committees that are non-traditional. It doesn't say health in it. So you kind of like, I'll check my email now, but that's not the case anymore. The federal government released $42 billion to states for broadband. And here's why it's important to us and why you need to go home and figure out who your state broadband person is and ask them how they're using non-deployment dollars. So there's this little, in all the fine print of federal, the NOA and stuff, where non-deployment dollars can be used for telehealth. But here's also the catch. It's telehealth adjacent is the term that I'm using. So maybe you already bill for telehealth, maybe you love telehealth, it's all funded. But if you put portal or system or data analytics or to assist with a connection to telehealth, there's a good chance you're gonna be able to leverage some of these federal dollars that don't have a lot of catches to them, like a lot of our traditional grants. Go home and ask. After a state builds out Wi-Fi and internet and the physical brick and mortar infrastructure, whatever money they have left over, they're allowed to use for non-deployment. In that list of things is telehealth. It's telehealth adjacent. Get your creative writers and make that argument. Just a couple things on public facing and then we'll wrap up. We do dashboards really well. One of the things that I have up here is our LODS dashboard. It's on opioid overdose information. This is really special because I often talk about this with legislators or elected officials. You can drill down by county, and we call them parishes. You can drill down by zip code. You can drill down by region. You can cut and paste all of the different data sources and get an example that looks like this, so you can compare. It's a really useful dashboard. So we did the same with 988. I think we were the first to have a public-facing dynamic dashboard. If you went on there, a legislator could drill down and see why are the calls coming in. They're kind of categories. Who are the calls coming in? We used it early to show people, you have no calls coming in. Do you not have a mental health issue? We don't believe that. So you either need to help us get the word out or kind of create more of a buzz that this is a resource that you can own. Claim that you brought it to your parish. It's fine with us, but you're getting no calls. Or on the flip side, look at what's happening in your community. Look what's important. Look what the top issue is. You go to rural communities, you see housing identified or transportation identified. That the more, I think what people outside of our world expect is that everyone's suicidal. And you can see in the graphic that that's not necessarily how 988 is being used, which I think is just beautiful. Let's see. And I'm going to end on maternal health. And really, this doesn't talk about our unique things that are going on. I think, because I'm going to talk a little bit about that, because we really just, in a real way, started to embrace a larger maternal health plan. Louisiana is top of the data charts on everything negative related to maternal health, maternal substance use, maternal deaths, infant mortality. And so we've really recently pivoted and made this one of our priorities. I have our medical director here in case I get any real questions. But a couple of things we're discovering, so this is less of a we're doing it well and more of a heads up, it's what we're figuring out are some of the barriers, is that we cover a lot of mental health and substance use services in Medicaid, but it has stayed, it's like the best kept secret with your traditional behavioral health providers. So you ask a substance use residential clinic or an LMHP what you can bill for, they go to the specialized behavioral health fee schedule, that's where they live, they know all your evaluations and it's great. We have OBGYNs, we have primary care doctors in LDH who's never once looked at the behavioral health fee schedule. And they come and they're like, we want to add this evaluation so every OBGYN can do this evaluation. And we're like, it's already covered. Can we introduce you to the second page of the Excel spreadsheet on Medicaid fee schedules? And so I think the lesson learned here is to have that communication with your non-traditional behavioral health providers. You guys like me live in our behavioral health world. We've been so blessed recently at the department to be pushed out of our comfort zone and forced to really interact with that primary care world. And it has opened up some amazing doors and conversations to really get women when they're in their first trimester and they see their OBGYN, or they're going to their PCP, or they're in their FQHC, to use, I think, the teen support, called it the bridge, to have that bridge to more services. That's a really great word. So I went really fast in my speed dating. We'll be around to see if we have a match later, and I don't think I have any time for questions, which may have been planned.
No, but thank you, Karen. Thank you. Okay, I got one more thing about Karen. So our research department is looking to clone her, because don't you want a commissioner in your state like Karen? Thank you, Karen. Okay, we're not done hearing about wonderful things in Louisiana. We are going to hear from Laura Evans, one of our wonderful Regional Policy Council representatives, and Colby Kelson, who is going to tell you all about the cool stuff he does at LSU. And come on up, Colby and Laura. Where's Colby? Oh, there we go. Thank you. Thank you. Glad you're here.
Yes. Well, hello, everyone. I'm Laura Evans. I am, as Debbie mentioned, a member of MHA's Regional Policy Council, and I'm also the AVP of Public Policy and Government Affairs with Vibrant Emotional Health, which is not only the 988 administrator, but also a member of the MHA affiliate family. So I actually don't have any slides because unlike Karen, I was like, I figure everyone at this point knows about 988 in the MHA family. I think I've hit folks over the head enough about how it works and the structure. But I do want to share with you all some of the work that Vibrant is doing alongside our federal partner, SAMHSA, and organizations like Tanja's Set Free Indeed, the Huntsman Family Foundation, and of course, Kobe Kelson, who I'll introduce soon. And so I think we heard both from Karen in the last panel and with the students who were in the peer support community that suicide is the second leading cause of death for young people, particularly those who are from 10 to 14 and then again going into young adulthood. And then as Tanja mentioned with her question, that statistic in itself, the second leading cause of death, doesn't actually dig into some of that demographic information. And as some other folks have mentioned, I think Karen mentioned this, Black youth are at particular risk. So during this time from 2018 to 2022, when white young people were experiencing a decrease in suicides, Black youth suicide actually increased. It was a 54% increase according to federal data. And so, you know, while we think of young people as a whole, that really shows that Black youth are at a particular high risk, and that is a population that we really need to get our arms around. And if you think about it, there's a lot of intersections of why that's difficult. And partly, you know, for a lot of historical reasons. But as the administrator of the 988 Suicide and Crisis Lifeline, our task is to make sure that we get our hands around all the populations that are at high risk. And so we have, through the years, created service lines for veterans because we knew they were at high risk. We recently introduced a Press 3 option within the last few years for LGBTQ young people. We have ASL services, a video phone for the deaf and hard of hearing community, which was also at risk. So we know there are populations that are at high risk. We know rural individuals are at high risk. And so one of the things we wanted to do for Black young people was to say, what are you doing? What do you need? How can we meet you with where you are and provide you with information and resources, decrease that stigma, encourage help seeking, and hopefully turn these statistics around. So of course, as we're having these conversations, you know, as my nephew likes to remind me, I am an old person. I was born in the 1900s. And so we often talk about having authentic communicators. So there is no more authentic communicator than someone that is in that community, that population. So Vibrant, we've been really proud to work with HBCUs, historically Black colleges and universities, to have sort of ambassadors for 988 crisis services, mental health, so that they can talk the language that they understand, right? If I try to use cringe or talk about TikTok, they're gonna turn off. But if they hear that from, I'm not gonna spoil, but if they hear that from their colleagues, then that gets them an in, and we heard that from the peer panel that was here. So one of the things that Vibrant did was partner with Howard University for their fashion show that they have to get fashion models to wear the 988 logo. We had lots of different swag. And one of the things that we've really been embedded with is Southern University through Kobe Kelson to ensure that we are getting awareness around 988 Lifeline crisis services and taking care of your mental health. So I'm very pleased to introduce to you all Kobe Kelson, who is a college senior at Southern University, right? So just keep in mind, because when I was a college senior, I was not this involved or active. So he's amazing. He is the section leader for the Southern University Marching Band. He is the director of outreach, I believe, for Set Free Indeed. He is the past president of his fraternity, the Omega Psi Phi. So please just join me in giving him a round of applause, and he will share what he's been doing.
And I hope it's okay if I use a handheld mic. Good morning, everyone. My name is Kobe Kelson. I'm very interactive, and I'm a student at Southern University. So if you guys could just open up to this HBCU experience I'm going to give you guys this morning. Can I get an amen to that? God is good. And all the time? Okay. So I named this presentation with the help of Ms. Laura, Trust in the Process, Lifting as We Climb, Gaining Student Support for 988 and Mental Health. Now, Lifting as We Climb comes very special to me. It is a motto that I live by, being that I have faced with a, how should I say, I am battling with depression and anxiety. I normally battle with depression and anxiety, and I've been battling with it throughout my life. So that is my story, Lifted as I Climb. As I try to go higher in my walk in life, I want to bring others with me. So being at an HBCU and being a student at Southern University, that's one of the number one things that we have to do is lift as we climb. And I'm going to be dramatically honest with you guys on explaining the process on how we were able to do such amazing work, how we were able to get such amazing things done on the campus of Southern University. And not only there, but at many HBCUs around the United States, and how within a 30-minute time we were able to reach some HBCUs, how we were able to reach just different institutions, and going to broaden your horizon on what an HBCU actually is. All right, so this is a picture of me. This is my name. This is my email, my phone number. It's also my Instagram if you guys want to scan. I'll give 1 second for that. All right. Introduction. What are HBCUs? So raise your hand. Who can tell me what an HBCU is? Okay. My brother with the amazing tie on right there. Okay, great. Outside of that, how do we identify what an HBCU is? Like, everyone tells me, if we ask what an HBCU is, everyone usually comes up and they say, an HBCU is a historically black college or university, but we don't really know, a lot of people don't really understand how they got to that point, and why is there such a differentiation between different universities and why we have this one title. HBCUs is any black or minority college that was founded before the year of 1962. So you have a situation where before the year of 1962 and before the idea that colleges and universities were needed for the African American population and the minority population, that those institutions were not actually considered higher education institutions, especially like the state of Louisiana, many of the southern states. And I'm going to give you a great example with this next slide. I want you to look at and see how there are in the South, where African Americans usually were due to the fact that we were brought in through slavery into the United States, that these are where your HBCUs preferably are, where the largest African American population is, and you can also look in the University of Virgin Islands. You can look at the states that don't have any HBCUs. But if you compare this to everything, because I know everybody in here knows what 988 is, everybody knows in here what mental health and peer support, I'm not going to use any of those special terms. Everybody knows these are those main states that are in need of the resource. These are the main states where you're trying to capture with 988, but you can see where these HBCUs are is where a lot of the worst, I shouldn't say worst areas, but where large masses of African Americans actually do live. And I'm going to bring this into reference. HBCUs are actually used as catalysts for communities. So let's say I live in Baton Rouge, Louisiana. I attend Southern University. Southern University is the only HBCU system. With that being said, that is the community's hallmark. That is where your community at the time goes for its agricultural education, its healthcare. At one point, Dillard University in New Orleans used to be Dillard Hospital. That was the only place where African Americans could actually go to obtain any form of medical help. They used to pay a penny a day, $3.65 for the entire year for their health care. That was the foundational principle in which we have our health care system that we have now. Now, that spun out, and then that was developed at HBCUs, and then it spun out into becoming this great system that we have today. But I'm letting everyone know that 988 is one of these things that can be pushed out at HBCUs, and it can expand. So not only that am I speaking on HBCUs, but I want to speak on the Divine Nine. So I'm a member of the Purple and Gold fraternity right here, but there are 9 other fraternities. If you don't know about them, this is the list, and we know Greek alphabet. So, for example, Alpha Phi Alpha, Alpha Kappa, Alpha Kappa Alpha, Kappa Alpha Psi, then Omega Psi Phi. This is also the order. It's only 9 of them. So at HBCU campuses, majority of the time, you do not have other fraternities unless they are honorary, but these are the main 9 that everyone joins. So I want to speak to the fact, and I actually was sitting in my phone, and I pulled up a statistic that I always reference back, and I didn't put in my slideshow, that among African Americans, 40% of members in Congress, 12.5 CEOs, 40% of engineers, 50% of African American professionals, 50% of African American lawyers, and 80% of African American judges attended HBCUs. Now, that's not even referencing that the majority of these people go on to actually join these Divine Nine fraternity sororities. And we're constantly in today's world hearing HBCUs, hearing Divine Nine, hearing HBCUs, Divine Nine. And everyone's now starting to branch off on this, but a lot of people don't understand what it actually is. So I'm going to speak to mainly 2 organizations today based on the HBCU campus. One is Omega Psi Phi, which is my fraternity. The second one is the Southern University Marching Band, which I proudly marched for the past 100 years. And I want to talk about something. Pay where the pain. This has been my number one instance and my number one mindset when it comes to anything dealing with HBCUs, and I want you to keep this in the back of your mind. Pay where the pain. I'm not talking about money. This is something that a lot of people underestimate. So I'm going to ask the question, and raise your hand if you started with a grassroots campaign. If your first instance of mental health was grassroots, raise them high, be proud. Okay. Now, with HBCUs, the foundational principle of everything with HBCUs is grassroots. Starting in someone's basement, in someone's church, in a church basement, in someone's home, and these people are paying their time. Not only that, majority of the times they did not have money to do a lot of these supports. So I want to give you guys a breakdown on what an HBCU is and how do you actually contribute to actually getting support and pushing 988 and pushing mental health at HBCUs. So pay where the pain. If you are not willing to give up your time, energy, it will not, and sometimes even opening up your home, and I see my mentor, Ms. Tanja Miles, sitting in the back. Majority of the time, a lot of these events that I'm going to speak about, actually 100% of them, we actually work hand in hand on. Hand in hand meaning her sitting in her living room or in her dining room kitchen and saying, hey, what do you think about this? And call them on the phone. Tell them, come over to my home. Let's talk about this tonight. What do you guys think about this? And then expand into going into on a national level. But I'm going to start off on the foundational principles. So, a fraternity life, HBCU campus, everyone is connected. Every celebrity, so let's say working with Fantasia, my first instance when I met Ms. Tanja was, I called her, I was like, can you pull up at this rehearsal? She's going to be over here. She came then. I had a professional development, and then I had a Miles for Smiles event that she pulled up on. And through coming to those events, she was able to see, okay, these are some interesting people. First, showing your face. So I'm going to give you, my first word to you is you have to show your face. If you don't show your face around the HBCU campus, you will not be able to facilitate, or mainly on the college campus as well. And I want to actually add on to you guys as well that showing your face is something that you really need to do on any university campus, because university students have the ability to do whatever they want to do, because they're the people who are paying the salaries of many of the workers. They're the ones who advocate for their university. They're the ones who can change legislation inside their university. And if you want to get them to move, you got to get in their face. So I want to play a quick video, and this is something Ms. Tanja and push very hard on, something that we were able to work on together. With me marching in the band, I can point myself out. I am right here, and it is so phenomenal to me. It's so phenomenal to me because of the fact that this was something major that we fought with, getting the band to spell out 988. And I want to specify that none of this has been done before in the history of me learning about 988. I've never seen a marching band spell it out, and why not the human jukebox? So if you could play the video.
To protect my mental health, I like to listen to music and go on walks and just try to clear my mind.
I like to just go home, turn off all electronics, go on Do Not Disturb on my phone, and just sit there and prepare for the next day.
I read my Bible app every morning, and I also read daily affirmations just to make sure I stay motivated in my day-to-day.
To protect my mental health, I just take little breaks during stressful situations and realize where you are and what you're doing and reevaluate the situation from a different angle.
I like to journal, listen to music, and like go on walks. The scenery really like uplifts me.
I personally listen to music, I read books, I give myself affirmations to know that I'm going to be okay, and I know that I am better at defeating my mental.
Please call 988 if you're struggling with mental health or you need someone to talk to.
And I do want to take the time. I want to take the time to shout out Miss Karen. Where's she at? Miss Karen, raise your hand. Okay, Miss Karen was also very, very instrumental in making that happen. And I want to talk about Louisiana Department of Health because I think that it's something phenomenal that they would take the time just to even focus on looking at what we're doing at Southern University. Because, like I said, in years past, Southern University has been open for over 100 years and it's never happened before. When we're talking about mental health, when we're talking about suicide, and people have been enacting this act for a very, very long time in the history of our university. And I even want to speak to some of the students who are in that video. Speaking about HBCUs, there's only 101 HBCUs, and majority of HBCU students are on Pell Grants. 75% of HBCU students usually are on Pell Grants, and usually about 16% of them are getting those federal loans. So I want you to think about how much anxiety, how much that might cause, or how much that might run through their mind. How are they going to pay for this? And they're just coming on a whim. Majority of the time when you arrive in the HBCU, it is a chance of luck that you're even able to pay for going to school. Majority of the time, people are just getting together and they're making it happen. So I want to speak to some of our events that we did host. So we have some of our students on the side right here, some of our band students who are in music class. And I want you to look at them and understand that they're majority of the time, HBCUs have a peer support kind of framework, I want to give it and say. Meaning it's always a situation where peers are working together, they're always striving together. So one event that was really a foundational event for us with getting students out was Yes, I'm in My Feelings, which was an event partnering with Divine Eye organizations on campus. We were able to get every single Divine Eye organization to participate with the help of the Huntsman Family Foundation, which is usually an organization that helps with us, the city of Baton Rouge, also Louisiana Department of Health, Set Free Indeed Ministry, which is our catalyst for a lot of the work that takes place. And one of the things that spun into was participating in a lot of those students who helped with that event were able to participate in the Bayou Classic. So in speaking about the Bayou Classic, and Ms. Karen, I was so happy that you missed it. My grandfather, in being in HBCUs, was able to participate in that first Bayou Classic, marching in the band, and then to see that we're at this 50th Bayou Classic 50 years later, and he saw that he had students on the big screen, was something phenomenal. Not only that, pushing a positive message. And then I speak to the band being a catalyst and HBCU organizations being a catalyst, being able to work with some of these students. Like these are students in the MLK Center. And as you can see, HBCUs are not just historically black colleges and universities. Sometimes I really think it needs to be historically minority colleges and universities because you have Hispanic students, you have Afro-Latinos, you have Salvadorans, you have so many different breakdowns in ethnicities currently at HBCUs to where it's never really been all black. And I think that's something that's a misconception that's happened. And I want to just shout out the Huntsman Family Foundation again, Vibrant and 988 and NAMI. Those are some drum heads that the band students actually were able to wear, participate in the Super Bowl, which was something phenomenal. Some students had never, ever been to a Super Bowl in their life. Then we go on to working with the members of Omega Psi Phi. So I want to speak on how 988 can actually expand to going not only to HBCUs, but to predominantly white colleges and universities. This is LSU students. That's a student from Southern. And this is our National Minority Mental Health Day. Also some push with Set Free Indeed, the Huntsman Family Foundation. These students are at LSU on something they call Speak Out Alley, if I'm not mistaken, on a term that they named it. And our students at Southern University are at the Union, which is the normal meetup spot that we have. And they're pushing out wristbands. They're pushing out 988 wristbands. Not only that these students, and I want you to see how interesting this picture is, these two ladies are from Salt Lake. some of these young men are from Africa. Some of these young men are from Houston. They're all HBCU students. Some of them are LSU students where they're coming from South Carolina. Like one of my line brothers is from the university, is transferred from the University of Virgin Islands. Then players to Omega and stayed over here. So HBCUs provide the diversity that 988 really was able to launch off of. I won't say launch off of because it was already amazing. I'm saying in HBCUs. And like I said, none of this has ever happened. Another phenomenal thing about working with HBCUs and pushing 988 is the fact that one day our national president actually came down and was actually, what are we doing? The correlation with HBCUs, why it's so phenomenal is because, and why it's very detrimental that you stay on your game, you're showing your face, is because of the fact that the ball can be dropped at any point. Where every single national leader has pulled up on campus and seen what are we doing. We do every single Thursday on Southern University campus, Tuesdays and Thursdays, we do a mental health night for the young men. We invite both LSU students, Southern University students, and Southern University students around the system because we have a Southern University New Orleans, Southern University Shreveport, so they sometimes road trip. And they'll come to see what we're doing and then want to take it other places. Now, on this day, it was actually our 988 National 988 Day that we were doing when it came to dealing with the Omega Psi Phi, and we were able to push it out to different chapters. Well, within a 30-minute span, we're dealing with the Divine Nine. I can reach any chapter around the United States in any state at any time because I have their phone numbers. The network is very, very small. I can get on any college campus. I can pull up over there if I need to. I can mail them wristbands in the middle of the night, and the next day I know they're going to be passing them out on campus. That's something that we did. Not only that, you can see bringing young ladies, we were able to partner with Alpha Kappa Alpha, which is another sorority, the first African-American sorority. Omega Psi Phi was the first African-American fraternity found on HBCU campus. So it goes back and farther and farther and farther to where you get to correlate and work with some of these people who were in our footsteps, and now that also will bring support with funding. That will also bring support with seeing how it mobilizes a lot faster working with HBCUs. Okay. This is our day we did it with the band, World Mental Health Day with the Southern University Marching Band. And I want to shout out Ms. Tanja again for being able to give these dolls and these amazing hoodies. But the students on Southern University is nearly like the weirdest thing ever. We gave them hoodies 2 years. That was also with H&E, which is a major equipment company in Baton Rouge, Louisiana. You know, and their motto is it takes grit. On the back of their hoodies, it says they take grit, but on the front it says 988. On their shoulder it says 988. And it's so phenomenal because the students sometimes don't wash the hoodies because they don't believe in washing the hoodies when they go to practice. They put them on and they wear them all day, and they don't care about how they smell. They wear them hoodies 24/7, and I'm being 100% real. But that's built off of the pride and tradition, sweat, grit. It takes true grit to be a leader. You know what I'm saying? You know, I hope that you guys understand it. Amen? Now, that also spins in advocacy. When it comes down to, you had students on the HBCU campus, they're a part of this, and I'm going to point this out because he's an Alpha, she's an AKA, she's an AKA. They're trying to join Omega, and they were able to come together and advocate for mental health laws, different rights, and also we have Senator Regina Barrow, who's on there as well, who's our Senator Pro Temp. We're able to correlate, because not only is she a graduate of Southern University, but she's also a member of Zeta Phi Beta. So I keep on talking about this link and this chain. It's constantly going where everyone's trying to lift as they climb. And here's a good touch-up picture, so you guys can see. Now, I want to speak to some more of that chain because I think that many people don't understand when you're talking about pushing initiatives like mental health, 988, when you're talking about peer support, you have to understand that everyone's connected. So a lot of times you want to go straight up head and say, look, I want to talk to the head person at the university. I want to get with the head people who's the top of the chain. And I want to say, look, we're going to drop this and we want you guys to facilitate this, and it's going to be amazing. They're going to be like, on your side on HBC, they're going to be like, great, we can do it, drop the check. And guess what? Sometimes you have to have people foot on the ground. We're all wearing our shirts that say strong mind, strong band. This was the day we were able to put together the band for the actual 988 spelling. But the correlation behind it is that we were the ones who woke up the students and said, hey guys, it's time to get up. The marching artists come down from the band director. We were able to get everyone activated. I'm telling you guys that the students, when it comes to 988 and when it comes to pushing 988, were the main catalysts that make everything truly happen. So if the students are not involved with it, it just will not happen. So these are also situations where we're able to invite our students to come and eat, come and fellowship and talk and get their actual ideas on where they want to stand, what do they want to change, what do you want to see? If is there something wrong with 988 that they might need to want, or they might want to communicate? Are they confused about something? Do they know what it is? But it's small group efforts that make the better change. And then talking about that chain link, majority of students who are young black men, who are young black women, they end up graduating and become parents of young black men and young black, and that chain keeps going until their kids now know what 988 is, and it becomes something hereditary in their family. All right, and I want to speak to these hoodies. College students love apparel. You know what I'm saying? They love clothing. So when it comes down to it, the best route that we took when doing this was actually giving them something that they can physically wear, because they're not going to take it off. These are probably going to be passed down to the next, like for Omega, we don't believe in throwing away anything. We wash it, pass it down. I'm saying that to say that if you get a hoodie that says 988 and you make it purple and gold, that hoodie is going to be worn for a lifetime. Seriously. And I was laughing because last night I had a shirt on that was said like 1964, and my chapter was founded in 1936. So the craziest part about it is that I'm still wearing something from 1964. If we had imagine if we had 988 back at that time and we put on there, how many people would truly see that? So we're going to move on to the Grand Conclave, and something that is vital for HBCUs and for the Divine Nine is our meetings. So the Huntsman Family Foundation, thank you so much, was able to sponsor the Grand Conclave. But not only that, we had representatives there who had built up this chain, like Ms. Tanja, went from talking with the chapter level to the district level to the state level, then going all the way to the national level. Now she's able to become best friends with our national president. They talk all the time, but the foundational principle of it is we work with the students first. The students are able to get us all help. We support the students. We pay into the students. We sow into the students. Then that spans out into the students using their social media, using their platforms, and be out for mental health. This was the first flyer that we actually were able to post it. It went from this first flyer to our meeting where every single brother in there is wearing a wristband that says 988. They will never throw those away. Then it spins into going to the Grand Conclave and standing with our national representatives. And then now you start finding a correlation that, well, he's on the national level, he graduated from Grambling. He's on the national level, he graduated from Grambling. I attend Southern University. We had the Bayou Classic last week. Oh, I saw them. They were sitting down. We said, oh, how's everything going with 988? I didn't forget about that. So having those times, those intimate moments is really what makes the change. And not only that, to be able to push it at our Grand Conclave in front of over 50,000 African-American men, and we had a moment where one of the brothers on the national level said, hey, I want to just talk about the National Suicide Hotline. Christ and I had to bleep out one thing where it said some secret out fraternity, but National Suicide Hotline, 988 Crisis Line. And, it's just something phenomenal when you're able to see it on a local level. If it wasn't for the efforts that took place at Southern University, they would not have actually had a conversation about it, per se. If it wasn't for the Louisiana Department of Health, if it wasn't for the Huntsman Family Foundation, it wouldn't be a conversation at all. In our area in Omega, now I want to correlate to a little bit more of the grassroots efforts. Going to local high schools, going to every single student organization on the campus of Southern University. Not only that, going to these local schools and bringing resources, bringing food, and giving them a little sticker that I remember we had, Miss Laura, I want to shout you out, she designed a little sticker we had that said 988 on it, and the kids wore them around school, and they're like, I just don't want to throw away, can I get one? Going to these local high schools, again, like I said, being around having people actually come down to talk to you, having a Huntsman family come down to talk to you personally, and having that conversations, those are the things that actually generate change. And not only that, I want to shout out iCare as well, with Miss Laura and Miss Tanja again. And something great about our Divine Nine fraternity sororities, she's wearing our Be Out for Mental Health. We consider her like a mother of our chapter. But like I said, it started from that ground level. And I want to speak on why I spoke the horn. I wanted to end that on why I spoke the horn. The fact that wearing those hoodies that have 988 on it and going and visit local high schools and different things of that nature, I bring my horn everywhere with me. It brings down depression and anxiety. So for me, I wore my 988 hoodie visiting elementary school. I didn't think anything of it, but the teachers were like, what is 988? What is that? So those are the things that make a difference. All right, that is my end of my presentation. I don't know if anybody has any questions. You good?
Thank you, Colby. Okay, I need one of those purple shirts. I'm just saying, purple is my color. You were marvelous. All right, come on, say thank you again to Colby. Woohoo! How's everybody doing? Everybody doing okay? Okay, we're going to slow things down just a little bit before lunch because I know we're all really excited and I can't send you out there to eat yet. We are going to talk about some of the things that our amazing MHAs are doing across the country to help people after there's been some traumas. So I'm inviting up here Renee Tomczak from our MHA of Houston, Kay Denal from our MHA of Mississippi. Who else is, let me make sure I got everybody up here. Brian Taliesin from our MHA of Hawaii, and Stephanie Francis from our MHA of Louisiana. Ben, are you going to facilitate? Okay, so we got, hi, come on up, Renee. We have quite the crowd up here, but they're going to tell you about some of the amazing things that our MHAs around the country are doing, and then we got a fabulous lunch, and then you can all schmooze, and then we got more. Ben, take it away.
Great, thank you, Debbie. I am Ben Harrington. I'm the CEO of the Mental Health Association of East Tennessee, and I'm one of the regional policy council representatives, so I'm happy to be here. One of the things that I need to do before we get started with this terrific panel of our colleagues from some of our fantastic affiliates across the country, we're going to have two affiliate panels today, and this is where some of the very tough work that we all experience comes into play. And so I need to, first of all, give everyone a trigger warning. Some of the folks today are going to talk about very tough things that they have encountered in their affiliates, or they have encountered directly, or the people they serve have encountered. And so we want you to know that this session is going to be tough. The affiliate panel in the afternoon is also going to be tough. And of course, we want you to take care of yourself. And you know, this is a trigger warning that if it is something that becomes too much, we encourage you to take care of yourself and step out of the room if you need to. So with us, as we know, we've got some fantastic affiliate representatives. And do you all have an order you want to go in?
I don't want to go first.
Yeah. Renee wants to go first.
No, I don't want to go first.
Well, you know, that's proof that men only hear 50% of what's said. Yeah. So, okay. All right. So how about we start with Stephanie? Sure. Okay. We'll go sort of in chronological order. So Stephanie, then Mississippi, or Kay, and then we'll get to Houston, and then we'll wrap up with Brian. How about that?
So first of all, no one brought a trombone, so that's a little disappointing already. We are starting on a very low note. I'm just going to tell, we've only got 5 minutes, so rather than go back into the statistics of Katrina, I'm just going to tell a bit of an illustrative story. Karen spoke a lot about what we're doing in Louisiana on crisis services and how we've layered that, particularly in response to our emergency services. A lot of the seeds were planted with Katrina, which hit in 2005. And I actually worked on the Mississippi Gulf Coast. I worked for the governor of Mississippi after Katrina. So I had more of the same experience as Kay rather than in Louisiana. where it was really a flood event. But I wanted to start, I wanted to tell you a little bit of a story that I think is illustrative, and I think as we talked as a panel, we realized the level of trauma that stays with you, that you bury after an event like this, because you're operating so low on the pyramid after an event that you slowly climb out of that, and that feels like a success. And a lot of times we don't deal with the underlying trauma of that event. I was born in 1969, and that is the year that Camille hit the Mississippi Gulf Coast. So I was 6 months old when Camille hit. My aunt and my uncle lived in Pass Christian, and they lived in an area that was protected by a barrier island. So Cat Island protected their little area. And the storm came in, and their house was fine, and their church was fine, and their parish was fine, and their life was pretty good. My aunt was raising her youngest child, was 6. She had 4 children, so she was in the thick of child rearing. And my uncle, who was a very prominent attorney on the coast, spent a lot of time really steeped in the recovery of Camille. And she did too. She did a lot of volunteering. She helped with schools. She helped get the people fed because they were fine. They took in neighbors. They did a lot of work after Camille. They were very steeped in the recovery of the Mississippi Gulf Coast. Fast forward 36 years, and Katrina hits, and people who went through Camille thought that was a once-in-a-lifetime event. Nothing will ever be as bad as Camille. Nothing will ever damage the coast and be a destroyer the way that, and a killer, the way that Camille was. So people were quite shocked when that was replicated in almost the same way with Katrina. Came in a very similar path, hitting in Waveland, and my uncle was already in the throes of dementia, so not available or without the mental capacity to really understand that. But my aunt in her late 70s very much understood Katrina. She went to sheltered in Birmingham and then came back down pretty quickly because once again, Cat Island had protected their house and protected her parish. And the place, her friend where she went to go play bridge. And so her little area, once they got power back, which was 6 days after Katrina hit, Mississippi Power, but 6 days after Katrina hit, everybody who could have power did have power. And so she came back and she lived there, and I worked all over the Mississippi Gulf Coast because I worked in helping nonprofits and helping national foundations and FEMA dollars get connected to our nonprofits and get on the ground as part of the recovery. That was really my role in the recovery. And I would very often find myself in Pass Christian, and at this point, she only had one of her children living down there. So I would stop by my aunt's house. And I was so engaged in this, and I kept wanting to hear stories about how my uncle and what they had done after Camille. But her rule was you couldn't talk about it. Katrina had not happened. She didn't want to know about it. She didn't want to hear about the recovery. She wouldn't drive down the beach. She went in her little triangular area, and that was it. And I think that's so illustrative, and what we found when we started this conversation about this, about the events, that the trauma stays with you. And it only takes another event until that resurfaces in one way or the other. And I did not understand why my aunt felt that way And I just couldn't get my mind around it, even though I was 36 at the time. I was not super young. But 2 years later, I'm living in Baton Rouge, and we have a hurricane, and our power is out, and I'm living on this small dead end, and it goes on and on. The power's not restored. And I went to the Entergy office finally. It's our power source in Baton Rouge. And I found the next thing I know, they're calling security because I am heaving, sobbing, and can't uncontrollably sobbing in the Entergy office. And the only thing they knew to do was call security. Needless to say, it worked out fine. We drove home. There were 3 trucks trying to get our power restored. But I think it just goes to show that it's the trauma, and I'm not, it addressed or not addressed, it still stays with us. And while you get back and you function higher up on the pyramid and you're doing other things, it's there and it's underlying, and then it becomes a catalyst for some of the other emotions as we go.
Great. Thank you, Stephanie. That was very impactful. Ms. Kay, you want to tell us about a different type of event?
Sure. So the area that I live in Biloxi, Gulfport area of Mississippi, we were also impacted by Hurricane Katrina greatly. And so fast forward 5 years later, we had the Deepwater Horizon oil spill. You guys will remember seeing those images and maybe have seen, there was a movie that Mark Wahlberg, I think, was in. It's very much heart-wrenching. But that explosion happened off the shores of Louisiana here, or, right off of here. And it was a BP rig, and 11 people died that day from that explosion. The leak went on for 87 days after that. And, just to kind of give you a little background, so there's a lot of people in Louisiana and surrounding states that work in the oil field profession. I grew up in Biloxi, and which is about an hour and a half from here. My dad worked out in the oil fields. He was a captain of a jackup barge. So he was on a boat that lifted up to a platform so that scuba divers and whatever they could work off of. So when you see that, first of all, it's horrific to see and hear what happened, first of all. But then you think of all those workers and all those moms and dads and daughters and sons and, all those people that either they themselves work in that field, and everybody kind of knows that something could happen, but you don't ever really expect that it would. So you think about all those people who are out there thinking that could have been the person that I care about. And then over that oil, they had oil that seeped all the way over to Tampa Bay. They found oil way over there. We were seeing all these images of dolphins and fish and hundreds of thousands of birds that died through all of that. And I know that sounds like, okay, it's the animals, but then you think about, okay, wait a minute, we've got fishermen here. This is a coastal area, fish, shrimp, all those things. People have their livelihood. And a lot of those people in those industries, they had already been wiped out from Hurricane Katrina. So they're still struggling, and now here's another big hit. So there was a lot of people, and after, years after everything ended, there were so many studies about how the mental health aspect of everything was so prevalent. And I think we're going to talk some more about some of the programs that we did and whatnot, but, then you think about the kids. Kids kind of feed off what's happening in their family and from their parents, the adults that are in their life. So whatever they're whatever energy they're getting there, the kids are feeling that too. And so we did some programs, some help with some youth in our area, and it was really interesting to see that they were still talking about Katrina. They were still, that was very prevalent in their minds. And every year, if you live down this way, and I know other states have natural disasters as well, but when hurricane season starts rolling around, everybody's talking about their stories. Oh, this is what happened to us. I remember this. We were out of electricity for 15 days or whatever it was. That's very fresh in your memory. It doesn't go away. So just like she was saying, it's there, and when something else happens, it just brings it all back up. And I could see where that's very traumatic, a very traumatic situation.
Renee?
So Houston is really unique in its weather challenges. So while Houston, most people think about the hurricanes, we also deal with 6 months of the year, 97 degrees every single day, really high humidity, yearly bouts of drought, and something, when I moved to Texas, I never thought about Texas freeze. So certainly, in the last couple of years that we have seen that. So Hurricane Harvey is what most people think about when they think about Houston. I wasn't there. I don't know what that trauma is, and I can't speak to that. I came from the Midwest. We deal with blizzards for a day or two, and we're done. So I'm going to talk a little bit more about what I observed when I got there 11 months later. So it was really at that point where people started to think about the psychological impact of the hurricane. Those first few months, almost a year, it was about basic needs, right? Making sure people had shelter and food. That's where what resources were focused on. That's where everybody was at. So I do remember when I got there, I had been there maybe a month or so, and we were getting a tropical storm, and flash flood warnings were coming, right? I never much thought about that, but the closest I can get to seeing that kind of trauma was my staff immediately dropped everything they were doing and started leaving. I said, "Where are y'all going?" And they said, "There's a flash flood coming. I have to get home. I have to protect myself." So it's really eye-opening for me, and I thought, what as an organization can we do, right? So it was, again, but about a year after it, money started flowing to our organization. So we wanted to think about what were some of the things that we could do to help mitigate when this happens again, because it's going to happen again, as certainly we have seen. So, I'm just going to share with you a few of the things that we do with the money that has helped us as we've dealt with continuing storms. So one was, as an organization, we of course expanded training, right? Lots of money flowed in just to do training, to educate people around their mental health and really taking care of themselves. But our big focus as an organization is really on youth. And so we partner with an organization called Ready Rosie. And so still available today. So if you're in a storm region, you might want to take a look at this resource. And it was modeled interactive videos that talk about how you talk with your kids before the storm, during the storm, and after the storm. So really a great resource, again, available to anybody, readyrosie.org, you can find that. Sorry, I had to write all this down. We have a workbook also, and all these things, of course, are on our website that was distributed through all the schools to use and continues to be used. So when a storm comes, we'll get a call and they'll say, do you have those workbooks, right? So keeping those kind of resources on hand. We also had a really unique opportunity, worked with a software company called Cognito and created interactive role-play simulations for educators, really pre-K through 12, on how educators can build their skills to help those students who are dealing with it, and also how to deal with it themselves, right? Because we have to remember they're certainly dealing with that. We, of course, did a video. I was there for the video and participated in it. Had an opportunity to look at it just as I prepared for this, and said it was really quite moving to see where people were a year later. And you talk about the trauma that still exists. Yeah, I cried. So that's closest I've come so far to dealing with this. And then it was almost a year and a half later where, for me, again, I was fairly new to Houston. I didn't recognize it, and I was surprised to find within my team we didn't recognize it, is something we don't talk a lot about is people who have hoarding tendencies. And so what we became aware of and needed to use our training skills was to train people who were doing the remediation for that, because there were those who had, again, the hoarding tendencies. They wouldn't let anybody come in and remediate their homes. And so how do you deal with that? So we were able to put our resources together and be able to train those people who were doing the remediation, how to talk to people, and then also train professionals, because there weren't a lot of professionals who knew how to deal with hoarding tendencies. So that's where we went, because the money was great, you know, but it's going to go away and move on to the next disaster, right? So we focused on what can we do to help for the next time.
Okay, Brian.
Thank you. I had a page of notes like Renee, but it's currently racking up mileage in seat 5A of an American Airlines 777. So I'm also highly neurodivergent, so I don't understand the concept of linear timelining, so I'm just going to kind of wing it. But the Maui fires is barely 16 months old, 16 months this week, actually, or yes, this week. So the ongoing trauma is still very fresh, still very real. During the fires, we have one full-time employee on Maui Island who I sent home early that day because there was a small fire. This is before the entire town burned down. We lost her for about 3 days. We had no idea if she was dead, if she was alive. We couldn't get in touch with her because all of the communication lines had gone down. 2,200 homes were burnt down, and about 12,000 people were displaced. There's still about 5,000 people who are being accommodated at local hotels. And to kind of give you an understanding of how new or relatively new the disaster still is, the first house that was rebuilt was completed just last week. Only one home has been completely rebuilt, and it took 16 months for that to happen. I also have some personal experience. My family lost 5 of their 6 homes. Thankfully, they all survived, and they're all living on the island of Oahu with me now. So that's nice. Most of the time, that's nice. But yeah, so, you know, and with the 12,000 people who were displaced, we don't know where a lot of them went. We had a lot of, so if you understand Maui Island, Lahaina is on the western or leeward part of the island. And it's just outside of the island's biggest resort area. So a lot of the homes that burnt down were occupied by renters who are either undocumented Mexicans or Filipinos or other people living in poverty because they're the ones who are working in the hotels. So many people left the island, and unless they were getting support from FEMA or the Red Cross, we don't know where they went. And I know that a lot of the undocumented citizens didn't approach Red Cross or FEMA out of fear. Which happens to be 13 of my 15 family members are undocumented. So the fear of asking for help was really, really real. You know, and my nephew made a comment just last week. He said, "I still cry when I hear the sound of sirens." Our response has primarily been sharing resources. Before I even woke up the next day, Shelley from Vibrant sent a list of resources and say, hey, Brian, let me know what I can do. These are the national resources that we can help direct you folks to. And keep in mind, no one on Maui Island had access to internet or phones, but we still depended heavily on sharing resources. And we also saw last year a 400% increase in the amount of people who were requesting mental health first aid trainings. So we certified 400% more than we did the year prior. So that's kind of been our response, like mental health resilience and wellness. We did stop suicide prevention trainings for about 3 months because it's contraindicated so shortly after a trauma. Like many disasters, there was tons and tons of conspiracy theories, some of them very believable. So we spent a lot of time in kind of helping to mitigate the facts from conspiracy. We actually had a lot more people from the corporate world reaching out to us asking for support. You might know that Hawaiian Electric Company was widely blamed for the fires due to a downed power line. Their employees, even the frontline workers, were being bullied and harassed. Kids who lost their homes had to relocate because their schools were also destroyed. The rates of bullying increased for those who were directly impacted by the Maui fires. So yeah, that's kind of where we are today. We continue to provide resources, our trainings. Suicide prevention is increasing a lot. We've kind of blanketed the state with our resources. We're not focusing in Lahaina. I don't know if you know, there's 8 islands in the state. We have a 9th island, which is Las Vegas, where a lot of local folks, there's more Hawaiians, Native Hawaiians in Las Vegas than there is in Hawaii, actually. So we've been reaching out to Las Vegas as well because we want people to come home. You know, for those who are in different counties, you know, we want them to know that it's a safe place to ask for help for us. We don't discriminate against citizenship or anything like that. And that's still a really big fear for a lot of people. So we're kind of putting additional priority on the undocumented community.
Great, thank you. Before we open up the floor to the audience to ask a few questions, I'm going to claim facilitators' rights. I've got 2 questions. First of all, this one's to you, Stephanie. All right. You mentioned the concept of the re-traumatization of a population from one traumatic event to another one years later, sort of like picking at a scab that had healed. What are we doing regarding that to try to help build greater resilience for those folks?
I mean, I think we're all doing it with our with the resources that we're creating, but I think there's I don't know that we're as a people that we're because now they're coming so fast and furious that I'm not sure that we can get ahead of them.
But your aunt's coping mechanism, don't talk about it.
Yes, which was quite effective for her. You know, I mean, we're doing a lot of mental health trainings. We have the 988, which we've discussed ad nauseum, which is now available. And we have a lot more national resources. But as people have mentioned, there's no communication ability a lot after a hurricane or after a fire or after a flood. So you can't get to those immediately. So we don't have any particular training. I think that's something we could look at. And as Kay said, we all, you know, that maybe is part of when we're getting our batteries and our flashlights and our water together during hurricane season, you know, maybe we get some kind of template, but we don't currently have anything.
Okay.
Were you about to ask her something else?
No, I'm good. You go ahead.
Okay.
You're chiming in. This is good.
Well, one of the things that we did after the oil spill was we did the Wellness Recovery Action Plan. I'm sure you guys are familiar with that, Mary Ellen Copeland. And because we really wanted to think about how to, like you guys were saying, build people up so that they can recognize what their own triggers and things are and have somewhat of a plan of how to react if something happens. So, you know, like we were saying, if once the hurricane season rolls around, then everybody's kind of on edge and that anxiety kicks in and all of that. So the RAP program really helps people to identify when those kind of things are happening and already have something in place, whether they've shared it with someone else or they just have it themselves, so that they can do some things to keep their anxiety and whatnot down. So I think if you're not familiar with that program, it's Advocates for Human Potential is over it now, and it really is a great resource.
Good. Okay, my second question is to Renee. All right, so you implied in your remarks about the flash flooding announcements or warnings creating a employee response of their anxiety and worry and urgency to respond to that. So I'd like you to elaborate more on how you deal with that as an employer, and has there been a need to work with the greater business community to build that responsiveness moving forward in a flood-prone area?
So on the employee side, our employees comes first, right? We're all in mental health and we know how important that is. So because we're not direct service, I think it's a little easier for us to manage as employees. It's okay, go home. Because honestly, in those first few days, it's not us that they're looking for. They need us. They don't realize that. They want to take care of their own personal needs. But it's really interesting that you asked the corporate question, because what we have found, and this is really more toward COVID, so it's nice that we're not talking about that, but that, that trauma still exists here. And we're doing more work around workplace wellness, and it's something that my Indiana colleagues here will know. We started talking about years and years ago, and I think the time is right for that. I had talked to an employer about a year ago, said, we're going to expand and do more around workplace wellness, just calling it in its broadest terms. He said, don't bother, they don't care, they just want to check a box. Less than a year later, calls me on the phone and said, I need you to come talk to my people. The employers have said, 80% was the response, but who need to know how to help employers help their employees, because it's impacting their bottom line. So I think if you haven't reached out in that community, I think you might find they'll be more amenable. And I come from a city with large corporate entities. The reason I wanted to do that work was, how many people can we impact, right? And so we're seeing that more and more and more and more interest.
Yeah. Well, as an aside, I think the legal implications of employers failing to heed the warnings and then their employees being impacted by the flooding at the work site, like with Hurricane Helene, and killing employees because they didn't send folks home early, that's going to change that landscape.
Yeah.
Okay, so we're ready for questions. Okay.
I have one quick side that Kate told us that when we were having our conversation, which was, I was so happy to hear this, but Houston has a lot of resources. You have a lot of foundations and a lot of givers. And the brilliant thing that they did, and I thought this was so great, was they said, Kay, we're giving you a grant, and you tell us, you write us a proposal in 6 months or a year. And so they gave them the grace to figure out what the needs are. And you said Kaiser came and said, we're going to give you a grant, and then we're going to give you the grace to figure. We trust that you know what you're going to use it for in 6 months to a year. And I think that's such a brilliant response, and that one that we can have after an event when somebody says, hey, I don't know what I'm going to use it for right now, but I will.
Yeah.
But I will.
Very cool. Okay, audience questions, and Alicia, you're going to take the microphone around? Good.
This is kind of a question / comment. Brian knows I have a staff member who is also from Hawaii, and I was actually texting her during this presentation. So thank you all for sharing your stories. We know how difficult these can be. One of the things that she mentioned was that her mom just went back to Maui, and it continues to be a very difficult loss, not just for the physical part. I'm actually going to pull it so I don't screw this up. No. But it's continuing to be a challenge for the people that live there, not only a physical loss, but a loss of history and culture. And so I wondered if you could just speak a little bit about that impact. And she sends her aloha.
Lahaina is a historic town. Hawaii was colonized by dough plantation, basically. So a lot of the counties are dependent on revenue from sugarcane and pineapple and tourism. And you might remember from Lilo and Stitch, this sounds so stupid, but Ohana is family, right? And it's a true cultural value that no one gets left behind. So even though the fires were in Lahaina proper, the entire state was grieving. So that's what I mean by indirect trauma, right? And the survivor's guilt was so incredible and still ongoing. One of the biggest challenges that we have, because Lahaina is a huge tourist attraction or tourist destination, we fought with the governor's office who wanted to open up tourism to the area. And in my world, there's no greater insult than turning someone's place of trauma into an attraction while you're still digging out bodies from the charred remains. So, I think there's a lot of things, and government is a barrier as well. They didn't understand the cultural values of Hawaii, so a lot of folks coming in from the mainland weren't very welcome. FEMA and the Red Cross highly gate-kept the response. And we had hundreds of mental health providers wanted to reach out and offer their clinical support, but weren't able to get to the island because you had to go through the Red Cross or FEMA. So there was a lot of disrespect for the cultural aspect and the historic aspect of the town itself, which people are still talking about. But yes, it's hard. I mean, even looking at Pearl Harbor, it's an amazing memorial that came years after the traumatization, and so I think a lot of for the local practitioners, Native Hawaiians, they're still very off-put by the loss of, and one of the biggest highlights of Lahaina, not highlights, but are these banyan trees that are so important to the area. They all survived. The buildings didn't, but those trees did. And that's something that people use to see hope. Like, they're still thriving. There's still life in Lahaina. I had a chance to visit just about 6 weeks ago, and it still looks horrible. The entire area is just charred remains still. But yeah, I think looking at the historic aspects of the community and the loss of that, because a lot of it has to do with the people who are in this area who left. So there's not as much respect for that loss. But I think there's going to be kind of like a renaissance to culture and community and increased respect for the historic aspect of it. Sorry, that was a long way of saying, yeah, basically. Yeah. Can I thank someone also? I wanted to say MHA was very supportive. Erica at the time was from MHA Arizona, Melissa were very supportive. Luis, I think, texts me every day for about 3 months, checking in on me. Thank you. I'm glad to see you're awake. But keep in mind, like many disasters, the process is a long healing process. We're looking at a 5 to 6 year process of rebuilding, not just resilience, but the physical and emotional and spiritual values that people have lost.
Great. Back to Shannon.
Thanks. So I have a question about how your affiliates or how your areas deal with sort of the continual reverberations that happen as a result of trauma, things like media coverage, anniversaries, memorials being built, things like that do bring up a lot of those thoughts and feelings that people were having, and ways you might be trying to get sort of in front of that as you see those things coming.
Go ahead. We have some strong media partners, especially, and I don't know, well, for us, we have one of the major stations has a health reporter who happens to sit on our board, purposely sought that person out. So she's been very helpful, even connecting with other stations. So they're able to push out some of the things that we do beforehand and that are available to help people prepare and know what's coming, and to think about their mental health and not just think about what are, like you said before, the batteries, So that's been really helpful for us, because we're a community of 8 million people here. And so we're just very proactive about that as we think about hurricane season, but again, also freezes, whatever it might be. We just stay very much aware of that and push that out and count on our media partners to help us in that.
As I was listening to you talk, I'm from Pittsburgh, Pennsylvania, and I was thinking about the Tree of Life shootings, which is the synagogue where there was a massacre, and it was the largest anti-Semitic massacre in the United States. And so much of what you talk about is so applicable, even though it was not a weather-related trauma, but also because I'm Jewish, and because the Jewish people had experienced the Holocaust, and there's a rise in anti-Semitism, I started thinking about like how much trauma there is still around this, and it's sort of, I guess you would call it secondary trauma, of people that weren't really at the event, but became traumatized as a result of that event. And I feel it. I drive by that building all the time. I see it. I knew people that were there. What advice or comment do you have about that? Because I think it's relatable. And do you? And what comments do you have about how to deal with that?
I think the second panel is actually going to speak directly to that. So, having not experienced that, I prefer to table that for them, because I think that's what they're going to speak especially to. But to answer Shauna's question too, the other thing that is, in addition to the preparation and it's coming and the anxiety and all of that, there's also highlighting the stories of how far we've come and what's happened, and that as a people is something that we've done in the state of Louisiana a lot of.
It's really giving people the hope.
Yeah, giving people the hope, yes.
We've done this, we can, unfortunately, we live in communities where it's going to happen over and over again.
Yeah.
We have to remind ourselves.
Yeah. And it's not just, I've worked with teams too that have gone in after economic trauma, after you have a big employer pull out of a rural area, and it's very similar. I mean, the fallout is very similar.
I wanted to add to that too, Shauna, that in Hawaii, the fires, similar to the pandemic, brought the topic of mental health to the forefront like it's never been before. People who, and we have a large Asian, there's about 40% Asian community in Lahaina who typically, I'm half Asian, so I can tell the difference between my Asian side of the family and their willingness to talk about mental health. But that's been kind of a motivating factor for us too, and we want to keep that conversation going so people are still paying attention to not just coping strategies or self-care, but actually seeking the clinical help that they need or deserve even.
Okay. So to answer Shanna's question a little bit, I think the anniversaries are important. The community is certainly going to remember. And the media, unfortunately, does not always think things through. They want to cover the anniversary of whatever traumatic happened, and they don't think about re-traumatizing the community they serve. And so that creates an opportunity, if you will, for us, for you, Shanna, in Minnesota, and Renee in Houston, et cetera, to be the voice of reason in the room and refocus or deflect the conversation away from the traumatic event to the positive that might have come out of an event. And so we all know the story of COVID doubling mental health prevalence, right? But it also forced many people to analyze their own mental health needs and then seek help with a mental health screening, et cetera. So that creates an opportunity to deflect the message away from the negative traumatic event to something positive. So many people have now been able to have that healthy conversation about their mental health, their family members' mental health, and have now done something positive to seek help and enter treatment. So that's a tremendous opportunity too. Yeah. Final question. I know we're standing before lunch, and so folks are probably ready to kick us off
I was
the
just
stage.
going to say that since we're marking the before and after,
Yeah.
that and talking about the anniversaries, that all of us really realize, like, you know, when the events, that's the time marker, you know, that happened. I mean, and now we all have the universal of COVID, but, you know, it was like, oh, did that happen before Katrina or after Katrina? You know, I mean, and it becomes the time marker of things, which is the appropriate before lunch conversation.
Yeah. There you go. All right. What a fantastic panel. Thank you all.
We're gonna break for lunch. We're gonna be back at 1 o'clock. And when you see our wonderful affiliates who just talked about really hard times, give them a hug, please. We'll see you all back here at 1 o'clock. That was fabulous, and we ended.